Joining us at the 2014 ATS conference is Dr. Jeff Sagar. He is director of the Cottage Pulmonary Hypertension Center in Santa Barbara, California. Doctor, thanks for being with us.
Hi, Tom. Good morning.
What is the impact of pulmonary hypertension on patients? You deal with patients every day.
Yeah, it's a dramatic impact. Pulmonary hypertension can lead to significant disabilities and shortness of breath, and patients can feel tremendously limited when they get this diagnosis. Unfortunately, it's a diagnosis that can sometimes be delayed in getting to the right thing because patients present with very non-specific symptoms, shortness of breath, fatigue, dizziness, and it can take some time before they are ultimately diagnosed and put on the correct path.
What is the role of advocacy in the treatment of these patients with this disease?
Because this is an orphan disease and a disease that is rare, it really requires a tremendous advocacy, not just from patients, but from all people involved in the care. The patient advocacy, however, is a major factor in keeping patients up to date with the medical information. A tremendous help is, for example, the Pulmonary Hypertension Association has a patient advocacy section that provides them the update information. And what's important about this being an orphan disease is that patients need to know where to be able to seek the correct medical attention for this condition. And centers of comprehensive care are being developed by the Pulmonary Hypertension Association, where patients will be able to hopefully seek expert medical care.
What are best practices physicians can do in treating patients?
I think the best way to think about best practices for physicians is firstly recognition of this condition. This is a rare condition. It's a condition that is not always thought about amongst even physicians, and that if patients are not improving in terms of their shortness of breath symptoms, dyspnea symptoms, that pulmonary hypertension should be sought or looked after. There's are ways that we can do screening for pulmonary hypertension, but if there's ever concern about this, these patients should be at least referred to a center of excellence or an expert in the field that can make an adequate, effective diagnosis and get patients adequately treated for this condition.
In your experience in 2014, how are you able to treat these patients? Are you getting better at it every day? Do you still have the same challenges? How would you assess where you are?
Well, in 2014, we're very fortunate that we now have 12 FDA-approved therapies for pulmonary hypertension. Back in 1998, there was only really one approved therapy for this condition. So we've come a long way in the last several years with the therapies that are available. With the multiple therapies, so comes the complexity of which therapies to use, and we are fortunate we now have oral therapies, inhaled therapies, subcutaneous therapies, and then ultimately intravenous therapies for the sickest of the patients. How you decide on what therapies really requires an in-depth discussion with the patient, assessing the severity of the illness, and effectively tailoring a therapy for that patient.
Doctor, thanks for stopping by and sharing.
No, thanks, Tom. Thank you.
Dr. Jeffrey Sagar joining us here at ATS 2014 in San Diego.